Herbalists, please welcome another great friend, co-worker, and defender of our immune system, fever. Often misunderstood, mistreated. Let's welcome fever with plenty of fluids like teas, soups, even popsicles and jello. Fever is a beneficial immune system response. It is raising your normal body temperature of around 98.6 Fahrenheit to 99.1 or over. It is to kill and destroy the evil bacteria or virus invading your body. Now, these are general instructions during normal conditions for educational purposes and not meant to be taken as medical advice. Now, during severe virus and bacteria outbreaks, contact your medical provider or cdc.gov for advice. A low-grade fever can be treated with herbs and fluids. Healthy adults do not need to take pills to stop the fever. You need herbs to support the fever. Drinking hot teas and soups will help the diaphoretic herbs, those are herbs that promote sweating, to work better. Drinking plenty of liquids will prevent dehydration. People do not die of fever, they die of dehydration. A low-grade fever will normally last 3 to 4 days. A low-grade fever is under 103 degrees Fahrenheit. Now seek medical attention if your fever lasts more than 3 to 4 days. Consult your medical professional if you have a high fever. What is a high fever? Healthy adults, that is a fever over 103 to 104 degrees Fahrenheit. For children under 3 months of age, a rectal temperature over 100.2 Fahrenheit. Now, rectal is considered the most accurate for children. Children 3 to 6 months, a rectal temperature over 101 Fahrenheit. Now, if you have one of those temperature scanners, consult their directions. Children 4 months or older that have been immunized, that would be a temperature over 102 to 103 degrees Fahrenheit. Bad fever, seek medical help. Persons with serious health issues like cancer or HIV, persons that stop taking fluids or show signs of dehydration, persons that become unresponsive. Adults with fever over 103 to 104 Fahrenheit that also might include a stiff neck, they seem confused, or has trouble staying awake, severe pain in the lower abdomen, severe stomach pain, repeated vomiting, skin rashes, blisters, red streak in the arm or leg, severe sore throat, swelling of the throat, persistent ear aches, pain with urination, back pain. Shaking chills, severe cough, coughs up blood, has trouble breathing, seizures. When in doubt, seek medical help. People normally die of dehydration, not the fever. Dehydration can lead to kidney failure. Signs of dehydration. Chapped lower lip. Now, I know we all have chapped lower lips all the time, but this is when it was not there before, or a sticky mouth. Dark yellow or amber colored urine. Clear or light colored urine means you are well hydrated. Sleepiness or tiredness. Children will be less active, sometimes thirsty. Decreased urine output. No wet diapers for 3 hours for infants. Few or no tears when crying. Dry skin. Headache, constipation, dizziness or lightheadedness. Push teas, broth, electrolyte replacement drinks, popsicles, etc. Anything to get liquids. Any herb tea can be made into a jello. Substitute the hot herbal tea as the hot water of the recipe, or use a cold herbal tea as the cold water part of the recipe, or just use both of them. If you're opposed to sugar, make your own jello with gelatin and use honey to sweeten your herbal tea. Now, severe dehydration. Seek medical attention. Keep in mind, some of these symptoms may be caused by medications or other medical conditions that is normal for you. Extreme thirst. Extreme fussiness or sleepiness in infants and children. Irritability and confusion in adults. Very dry mouth, skin, and mucous membranes. Little or no urination, and it's darker than normal. Sunken eyes. Do the pinch test. Pinch the skin on the top of your arm behind the wrist and pull up. Make a little tent. Now let go. It should return to normal. If it remains like a tent, that is an indication of advanced dehydration. Seek immediate medical attention. You don't have to have a fever. Infants and children. If the soft spot on the top of the baby's head is sunken, low blood pressure, rapid heartbeat, no tears when crying, and really serious conditions, delirium or unconsciousness. Seek immediate medical attention. If you do not have these conditions that require medical help, support your fever with hydration, plenty of fluids. Keep the feet warm, the head cool, and not ice cold, just cool. A washcloth can be dipped in cool water, or a cool herbal tea will work. Use herbs depending on if it is a hot external fever or a cold external fever. Hot external fever, you feel hot inside and out. You might even have a red tongue. You might have yellow phlegm coming up on the tongue. You might have a sore throat. You might have a fast pulse. Treat with relaxing diaphoretic herbs. Diaphoretic herbs will help dilate the capillaries to let the heat out. Diaphoretic herbs make you sweat. Herbs like chamomile, which is easily found at your grocery store, elderflowers, now this is the flower, not the berry, yarrow, lemon balm, peppermint, which is especially effective for fever with nausea and vomiting, and this is also easily found at your grocery store. Use teas and tinctures of these herbs either by themselves or a combination. Make into jello or popsicles. And if you don't have these herbs, just make plain jello or popsicles. Boneset. Now, if you have intense aches and pains, Boneset is really good. Now, a good combination for fever is elderflowers, yarrow, and peppermint, and you would drink this as herbal teas throughout the day. Now, yarrow is kind of a bitter herb, and you might have to leave it out for children. Now, if you prefer tinctures, an adult dosage for tinctures would be 1/2 to 1 teaspoon 3 times a day. Now, if you have a cold external fever, cold to the bone, you're shivering, have an aversion to cold, the tongue is pale, white phlegm, slow pulse, itchy throat, do all you can do to keep warm. Bundle up. Take a hot bath. A quart of ginger tea added to the bath will help warm you up. Take 3 tablespoons of dried ginger, 1 quart of water. Simmer this for 10 minutes, strain, and add to your bath. Warning: now adding peppermint or other menthol essential oils will make you extremely cold. Saunas are great. Drink warm liquids with honey and lemon. Hot soups or broths. Chicken soup, steep with a little thyme. Chicken tortilla soup. Be sure and add the pepper. Egg drop soup with pepper. Use stimulating diaphoretic herbs. Stimulating diaphoretic herbs warm you up from the inside out. Sip as teas all day long. Ginger, dry ginger works better than the fresh. Take cayenne pepper, just a pinch, add it to warm water, and you might add a slice of lemon. Oregano. Now be sure you use the plant, do not use the essential oils. And hot peppermint tea. Now, if you prefer taking tinctures, you want to add these to warm liquids, and the tincture adult dosage would be 1/2 to 1 teaspoon 3 times a day. Hot, cold, then hot, and cold again. More than likely, you will keep going back and forth from hot to cold. Treat whichever symptoms you are feeling. Just can't take it anymore? These are some herbs to lower your temperature. Willow bark and meadowsweet, which will also lower your temperature and help ease the pain. They contain ciliatic acid, which is the chemical that is synthesized by drug companies to make aspirin. Now, caution, do not give to children under age 16 who have symptoms of the flu or chickenpox. People with asthma may stimulate bronchial spasms, and people who cannot take aspirin to begin with. Now, remember, this is not a religion. If this does not work for you, or you do not have these remedies on hand, use over-the-counter remedies at your drugstore or seek medical attention. Thank you for joining me at Family Guide to Herbs.